works here. I'm going to pull curtain for privacy. We do hand hygiene. Have him give me his name and date of birth. Have him state it directly while checking both wrists for his bands to make sure the information matches. I'm going to raise the bed up here to working height. My table has been cleaned off and prepped, ready for a sterile field. Do this to about waist height. They're still a little wet. I'm going to set a blue pad here before taking off the dressing in case there's any type of drainage that comes out. You don't want it getting into the bed. I'm going to go ahead and put on clean gloves here for clean technique.
Do we really have to do that?
And I'm going to go ahead and set up my sterile field. Open this, so I'm going to open. Toss this lid. I would only touch the blue side and the 1-inch margin around the sterile tray. Don't want to reach over the sterile field. I would apply my items here.
Hey, you want to find it on me?
This is its own little sterile field, so I can place it outside of the drape.
It's really hard. What I did, I normally have like 3 fingers, and then I kind of. That's what she did in the video. She was like this.
Open up the other one because we want one set of dry gauze and one set that'll be wet for packing the wound.
Okay, now where's my other?
Still place that on the sterile field. Maybe not. I would not have placed that there. I would have placed it here. This is getting a little small. I would not have placed that on the sterile field. How about that?
Yeah,
Limited workspace at the moment. Open my AVD.
radio, posterior. Where's posterior? I know, right? Second time? Really?
Apply my items to the sterile field, trying not to break sterility. And now that my sterile field is set up, I'm going to set up my tape for whenever we do change the dressing.
General area.
I would use a pin to mark the date and time that the dressing would be applied on one of these strips before, but he has a pinning allergy, so we're not going to do that. Playing with tape with gloves is not very easy. I did this before putting on gloves, but
And if they're like a healthy
terrible at wearing.
can you raise your arm?
Alright. I'm going to go ahead and change the dressing. I can get this little piece of tape off me. There we go. Okay. So we're going to remove the dressing. We're going to remove it from the bottom to the top. And if the adhesive is too sticky, we'd use adhesive remover to help reduce any type of skin tearing. Alrighty, toss this, but we're not going to. You would assess the dressing for any type of drainage, odor, discoloration in the discharge from the wound. We would assess the wound itself as well. We'd see how large the wound is, so we'd float this above to get the diameter and length of the wound, as well as using probes to check for tunneling and depth. And as you're doing this, I open this backwards. I'm not going to actually use this one, but I have a spare, so I'm going to make sure I open this from the right side this time. But as you're doing this, you would also assess the wound itself for any type of necrosis, infection, if there's any type of discharge within the wound as well. Use this, you would insert this to the deepest part of the wound, and you would kind of mark the side with the side of the wound to get an indication for how deep it is, and you would assess it against a measurement by floating on the top. And we would discard this as well. Now that we've assessed the wound, make sure there's no signs of infection. We've moved from clean to sterile technique. Before though, we would dump a little bit of sterile solution. We would dump off the top bit of it, clean the rim, and we would dump it into one of the two gauze bins, and you would open the other one in preparation for irrigating the wound. So, alright, Mr. Mannequin, is it okay if I use your bed to apply my sterile gloves for the procedure? Also, thing that I just noticed is I did not explain the procedure to Mr. Mannequin. I should have told him that what I would be doing, letting him know that I would be irrigating and changing his dressing, and the purpose of doing that for reducing infection and promoting healing of the wound. I would only touch on the outer edge, outer 1 inch of the sterile glove packet. I'm going to do the dominant hand first. These gloves are all kinds of tore up. Pull this down a little bit further. Alright, so now both my hands are sterile. We're about to do a dressing change. First thing I would do is fill the syringe up with a bit of sterile saline solution. Pull it out. Careful trying not to touch the rims when pulling it out. And at this point, we're going to lose sterility, and I just pulled that over that. I reached over my sterile field and I pull this around. And to irrigate the wound, we would press this up against the skin to create a seal to try and capture all the drainage. And we would apply the solution from the top of the wound to the bottom. And as we did, we would look for the coloration change, and you would apply it until the solution ran clear. It's running clear, so we would take this away. And now we're going to apply the new dressing. So this was the one that had the sterile solution, the wet gauze. This is my sterile hand. This is my unsterile hand still. So I would pick this up. I would squeeze out the excess moisture because you don't want it too wet. And you would switch hands and pack this in with I used too much gauze probably. You would pack this in with your non-sterile hand. Okay, usually that would stick because it's wet and moldable, but I cannot get that to stick. So we're going to place that somewhere else. At this point, you would also apply the ABD over the packing. Well, no, not just yet actually. You'd use the dry gauze to apply over and this is still my sterile hand, and I would drop this to my unsterile hand. And you would apply this over the wound. Apply 2 of them to cover the wound. They're not going to stick. So I'm just going to kind of verbalize it while showing it at the same time. At this point, there is packing and 2 dry gauze over it. So I'm going to pick this up with my sterile hand as well. And we're going to apply the sterile dressing, drop it with my other hand as well, over, covering the wound completely. And this time I have to make that stay. So at this point, I'm losing sterility on both my hands, but the wound is covered, and we are going to apply the tape to the outside of the ABD pad to secure it. And one of these again is marked with the date and time of the dressing change, but he is allergic to pen ink, so we don't want to do that. You're going to do this to all 4 sides of the wound, so it can hold itself now. You want to make sure it's tight but not uncomfortable to the wound. Alrighty, so now the wound is covered. We can begin to remove the material from the field. We would clean up our sterile field and all of our materials. We'll remove my gloves. These are super tight. And you would perform hand hygiene once again and cover up the patient, make sure that they're comfortable. You would also reduce the bed back down to reduce fall risk after surgery. And after that, you should be all done. Good day, Mr. Mannequin.